Why do digital rectal exam practices vary globally? Imagine trying to compare how different countries approach a simple but important part of prostate health screening. The digital rectal exam is a quick, low-cost procedure where a doctor feels the prostate through the rectum to check for abnormalities. But why do some places use it routinely, while others rarely do? The answer lies in a mix of guidelines, healthcare systems, cultural attitudes, and evolving scientific evidence. Different health authorities around the world have varying recommendations about using the digital rectal exam for prostate cancer screening. Some organizations suggest it mainly for men with elevated prostate-specific antigen levels or those at higher risk. Others have moved away from recommending it routinely because studies show it has limited ability to detect cancer early and can produce false alarms. These false positives can lead to unnecessary biopsies, which carry risks like infection or urinary problems. As a result, some countries have scaled back on routine digital rectal exams, favoring other methods like blood tests or imaging. The training and experience of healthcare providers also influence how often the exam is performed. In some regions, medical education emphasizes the importance of the digital rectal exam as a key clinical skill. Doctors trained extensively in performing it may be more comfortable and confident doing the exam. In contrast, in areas where medical training places less emphasis on it, or where doctors prefer to relying on blood tests, the exam might be less common. Healthcare system differences play a role too. In countries with limited access to advanced diagnostic tools like prostate-specific antigen testing or imaging, the digital rectal exam remains a vital, affordable way to check for prostate issues. Conversely, in wealthier nations with easy access to blood tests and imaging, doctors might relying less on the exam and more on other screening methods. Cultural attitudes and patient comfort are also important. Some cultures view rectal examinations as invasive or embarrassing, which can make patients hesitant to undergo the procedure. This can lead doctors to avoid performing it unless absolutely necessary, opting instead for less invasive tests. Another factor is the scientific evidence itself. Research shows that the digital rectal exam alone has limited sensitivity and specificity. It works best when combined with other tests like the prostate-specific antigen blood test, especially in men at higher risk. As new evidence emerges, guidelines are updated to reflect a more nuanced approach, recommending the exam selectively rather than routinely. Finally, efforts to standardize how the digital rectal exam is performed aim to improve its accuracy and consistency. Different practitioners may use slightly different techniques, which can affect results. International medical societies work to develop guidelines to improve quality, but adoption varies across regions. In summary, the way the digital rectal exam is used around the world depends on many factors. These include local guidelines, healthcare resources, cultural attitudes, scientific evidence, and medical training. All of these elements shape whether the exam is a routine part of prostate health checks or used more selectively. If you have concerns about prostate health, always consult with a healthcare professional who can recommend the best approach based on your individual situation.